welcome to Medica Nova Wellness Studio with your educational videos about optimal health and the most innovative and holistic approach to your well-being. I hope you're very well today. In this video, I'd like to share with you some useful tips how to manage and heal anxiety with natural and effective therapeutic tools. It's not your imagination. The rates of anxiety are increasing, especially among our young people. Anxiety disorders are the most common mental illness today in the US, to such an alarming degree that our millennials, usually the ages between 23 and 38, but also our teens, and especially our children are now affected, that this whole situation is labeled as an epidemic. A 2019 public opinion survey conducted by the American Psychiatric Association found that 68% of people, a staggering number, polled felt a combination of extremely or somewhat anxious most of the time. That means more than half of our population feels anxiety on a daily basis, and that's not quality of life. And that's why I make this video, to show you some natural, solutions here with a holistic approach to meet this situation, and hopefully with less medication. Enjoy this video. To stay updated with more ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. Of course, thank you so much for your thumbs ups and your likes, as they always help the growth of my channel. Have a look at our website, medicanova.net, at the Medica Nova online education, where you will find certified home study online courses in homeopathy, health and wellness coaching, mental health, positive psychology, health and wellness coaching, quantum healing, and so much more. One of our courses, called Positive Psychology and Mental Health, the Science of Wellbeing as a Choice, just got awarded and approved by the National Board Certified Health and Wellness Coaches with 12.5 continued education units. So any health and wellness coaches out there who are looking for their continued education points to recertify their license, here it is. Have a look at the website so for more information, and contact me also at health@medicanova.net. I'm happy to guide you further here. So what is anxiety? Well, anxiety is defined as a feeling of worry, nervousness, sort of uneasiness, typically about an imminent event or something with an uncertain outcome. So you feel like you're losing control, right? Or you're not in control anymore. Of course, while it's common to feel concerned about something or worry about something, an anxious person really experiences this dreaded feeling pretty much in every aspect of their lives as well. So it can be within your work environment, within your family, sort of nucleus, the relationship to your spouse, to your children is affected. You worry about your health. How about your finances, right? It pretty much goes in every, or sort of seeps through every aspect of your life. Now, let's look at different types of anxiety first to get an overall understanding, so you can relate to what I'm actually trying to convey here. Types of anxieties. We have the general sort of anxiety disorders, which affects about 3% of the population. It's characterized by this uncontrollable, persistent, excessive, and also unwarranted worry. It's like you worry now about trifles, we call it. It's everything, right? Everything is a trigger suddenly. We have obsessive compulsive disorder. Here we see excessive thoughts, which are now leading to repetitive behaviors. We also have social anxiety. that involves fear or social sort of like anxiety about performance. Maybe you stand on a stage and you think like, oh my God, what would happen if I lose my lines? What would people think about me? Maybe you have to go to the bathroom all the time, right? The body starts to express symptoms. Panic disorder, well, that's where the anxiety goes up in strength and intensity. It's for someone who has recurrent unexpected panic attacks. You maybe have the body, trembling, or you can't breathe anymore. So the symptomatology is changing. Anxiety about medical conditions, right? Person has anxiety and panic, about certain health problems, what they're suffering from right now. We have the phobias, which are more sensation of marked fear about specific things. Maybe you have fear of flying or public speaking. Of course, we want to mention here the post-traumatic disorders describe difficulty recovering from experience or even witnessing terrifying events and trauma here. Right now we have massive wars. Millions of people are displaced. A large amount of the world population are now experiencing post-traumatic stress disorder, separation anxiety disorder. Describes recovering, maybe from a loss of a loved one, or a pet, or even just separation of your marriage. You're going through a stressful divorce. Substance-induced anxiety disorders, and this refers to anxiety resulting from misuse of certain drugs, medication, or even withdrawal from drugs. I also want to here mention selective mutism. That means the children fail to speak in certain situations, especially in public situations, but actually are very expressive within the home environment or among family members. So, of course, that needs to be explored. Is there anxiety involved? Anxiety also leads often to depression, and it's estimated that about half of people with anxiety also experience symptoms of depression, and that even can lead to bipolar disorder. Let's have a look at the symptomatology, because I would like you to understand that anxiety is sort of an umbrella word, but you out there, or anybody you know, a friend or family member who experiences anxiety, has an individualized expression, right? Everyone has different sort of symptoms, so to say, and here, therefore, we need individualized, personalized treatment protocols. It's not just great to just give a pill which covers everything. That's not good medicine. So anxiety symptoms are linked to the body's fight and flight response, which describes also these psychological or physiological reactions in response to a perceived attack or threat. And somebody who really experience anxieties, this is as real as it gets, and it's very difficult to snap out of it. People say, oh, just breathe and, meditate or go for a walk. Now, if somebody is really in an anxious state, the body reactions take over, and you get almost anxious about the bodily reactions on top of it. It's a very difficult situation. Now, symptoms can affect every part of the body and every system here. So we talk about the central nervous system, as well as your digestive system. Remember, we talk about digestive system is also called the second brain. It contains more neurons as your actual brain. We talk about endocrine system, like females get very much affected with the hormone imbalances here, cardiovascular system, and so on. So we start with this persisting worrying, constant, it's on your mind, it's almost tormenting you. With that, eventually the body creates muscle tension because you're constantly tight Maybe your neck pain starts to happen. Your chest is tight, or you feel like, God, I feel like an elephant is sitting on my chest. We see heart palpitations. Your high blood pressure goes up, right? Racing heartbeat. Trouble sleeping. You're restless during the night. You toss about. Others experience shortness of breath, especially when they go into panic attack and their body starts to tremble. Digestive problems. If you already have irritable bowel syndrome, that maybe is exaggerated, or suddenly you experience an alternating between constipation, most of the time loose stool. Your appetite is affected. Your mood swings get out of place, right? There's more irritability, or even leading to depression. Anybody who experiences anxiety has a lot of difficulty concentrating or focusing on something. Others experience physical sensation of excessive sweating, maybe frequent urination, particularly public speaking or meeting, an ordeal, then people suddenly go to the bathroom all the time. Others experience more dry mouth, or dizziness, or regular headaches. We definitely see more a sort of an inability to socialize. But all of that can actually lead or cause really more physical condition or mental condition, like, for example, eating disorders, anorexia and bulimia. I mentioned the headaches, but now it's suddenly a migraine or, tension headaches on a regular basis. ADHD, attention deficit disorders get heightened. I mentioned the digestive disorders. Maybe this causes your irritable bowel syndrome or your ulcerative colitis or your Crohn's disease, or it, when you have it already, it exaggerates it. Substance abuse problems are definitely more in the increase. Needless to say, sleep disorders. I would say also chronic pain is more persistent. If you are a sufferer of fibromyalgia, that can be more exaggerated. You see, it's like it's all connected. The exact cause of anxiety today is not really understood, and when you have tests, there isn't any black and white test. It means your doctor will establish, according to your expression, if you have a susceptibility to be anxious, and therefore prescribe the medication. Of course, if you have thyroid disorders or deficiency of vitamin B12, these are factual things. But most of the time, we don't have here direct guidelines of a diagnosis, and it depends on the professionalism of your healthcare practitioner. But most of the time, I have to say, it's stress, and it's this poor or challenging life circumstances. So many people report that life problems are contributing to their level of stress, and they include often exhaustion due to long working hours. Maybe you have to commute many hours to get to your work. Unemployment rate, money problems. Right now in the US, the food is 30% more expensive. Every utility bill is going through the roof, right? Particularly house insurances. So we all are affected. Of course, losing a loved one, separation, feeling lonely and isolated. And here I would say, since 2019, going through this horrendous pandemic, people got very isolated and still struggle from that with mental illnesses. And of course, our teens being bullied, exposure to, violence, traumatic life experiences. Talk about war and got even abuse, right? I mean, I don't want to mention here it in detail. Don't blame it always on the family history or the genetics, because they play really a minor part here. Today, we all have a choice, and what you establish within yourself, your environment, that means your thoughts, the quality of your thoughts and emotion, as well as what you expose yourself in the external environment will determine the behavior of your cells. It's not the genetics. We can bypass that part. Sure, there can be some chemical dysfunction. Maybe serotonin is here a little bit weak. Excessive alcohol intake, excessive caffeine, an unhealthy diet, too much sugar, all that can, of course, add to it. Drug use, I mentioned the hormone fluctuation. That can be also during pregnancy, females going through menopause and all of that. Don't forget the thyroid issues here. I want to say certain medical disorders here also predispose more anxiety. And here we have, of course, if you have overfunctioning of your thyroid, heart complaints, asthma, right? If, of course, cancer, but also neurological disorders, maybe Parkinson's disease, all of that can add to experience more anxiety. So why is anxiety increasing now? It's like a little bit more of a complex situation. So many of these causes have affected people throughout history, right? It's not a new thing. But why are our bodies not able to adapt to environmental changes? And in our understanding of health as healthcare practitioner, which come from integrated medicine, we say health is the ability to adapt to environmental changes. But for some reason our body can't do it anymore, or our mental state can't do it anymore. So people report being most anxious today about health, about the safety, right? We can see that, about finances, politics, and relationships. And experts believe that these concerns may be also provoked by this 24/7 news broadcasting, the rise of social media, and near constant digital connectivity. When you see teenagers in a museum, they don't look or savor, the moment of a brilliant art piece anymore. They just huddle down in little groups and sit on the benches and scroll down their phones, right? It's very sad to see that we see this disconnectiveness. And just going through nature, experiencing, feeling the power and the beauty of nature is sort of an unfamiliar thing, which in my time definitely was part of upbringing, right? It's very sad. So busy schedules, maybe, that leave little time for regular exercise now, sleep, relaxation, time to socialize. And there's the fact that people also, are not eating a healthy diet, and I understand. The food prices are through the roof today. It's not easy to say, live on organic food. So that's why here where I live in the US, people now really start to cultivate their own gardens, go back to really planting and cultivating your own food, taking more medications that have, huge side effects, or suffering from more chronic health problems that are very burdensome today. Experts recently explained in the Washington Post the compulsive pursuit of substance abuse and addictive behaviors is causing severe unhappiness and depression in the US, and we have an opioid crisis. So this is why some argue that anxiety shouldn't be viewed as more as an individual symptomatology or problem, but rather it's inseparable now from wide-ranging societal issues like political upheaval. Right now, the country is so separated and everyone just talks about this crazy political situation, environmental catastrophes, hurricanes, volcanic eruptions all over the world, earthquakes, floods, trauma, and also discrimination. It's not easy anymore to say well, because you worry about your finances, just, relax a little bit. This is more of a complex story, and that's why we need better treatment protocols. I just want to give you some statistics. I know statistics are boring, but it gives you more of a broader understanding what I really want to home into here. So different races and ethnicities and people of all ages seem to be worrying more than in previous years. As I said, the millennials are also very much affected, more than older people today, but especially the baby boomers reported the greatest increase in anxiety symptoms. So in developed countries, an estimated, they say 50% of mental health problems are established around the age of 14 and 75% around the age of 24. And that's why I think it's absolutely important to help and treat the young generation, right? They're the future for us. And if they are falling apart, there's not much hope here. So which country has the highest rate of anxiety? The World Health Organization has found that more richer countries, right, because the stress level is higher, the expectations are higher, have in general higher rates of anxiety than in comparison to population in more poorer countries. Yeah, because it's down to earth more. They have to simplify, right, which is in this case much healthier. The WHO estimates that worldwide 1 in 13 people suffers from anxiety worldwide. In countries like New Zealand, Australia, the US, Spain, even Ireland and France are more affected than other countries. In fact, 63% of Americans say the future of the nation is a significant source of stress. Yes, it is. And 59% feel that the United States is at the lowest point they can remember in history. Roughly 40% of Americans report feeling more anxious than they did 1 year prior even, while another 40% say they're equally anxious. Now, the greatest sources of anxiety among adults today include keeping one's family safe. It's really sad that we come to this, statistics in a way. We worry about health, but we right now worry very much about the expenses, our finances, the wealth, the politics, and our relationships. So these are the aspects where people really home in right away. And here it comes. 1 in 3 people, that's 37%, suffering from anxiety receive treatment. That's not good enough. That's not good enough, right? Without negotiation, we need better health care. And, it's not about the medication in itself. It's about finding out the cause, trying to really help you, to empower you to elevate yourself out of this mess, and then really feel like you are in control again, and you can have an 180-degree turn and maybe choose more healthy solutions here. Right? It's not about you being the victim of this situation. I want to empower you to say, hey, I have a solution. I get out of this and I can do it. So what are the conventional treatments? Well, to manage severe anxiety symptoms, you usually get somewhere selective serotonin updates, inhibitors like SSRIs or SNRIs, sedative medication, benzodiazepine, antidepressants, and so on. But I don't want to go here into detail, but they all come with side effects, right? And we don't want that. You're already suffering from anxiety. Often when you get medication, here I say absolutely I support that. It's often in combination with therapy, cognitive behavioral therapy, which works by identifying, challenging, and then also neutralizing unhelpful or distorted thoughts underlying anxiety disorders. So that is very helpful, and you should go for that, right? You should find out the cause. what are the triggers, and how to change that, reverse that frequency within your thought patterns. Of course, we have natural treatments, and here we start a little bit in this video. Sure, relaxation techniques like mind-body practices are so helpful here. Here I highly suggest Qigong on a daily basis. Absolutely, I do it every day. And I couldn't do my job so well without these practices. Regular exercise, don't forget that, it's absolutely important. Needless to say, a healthy diet, right, includes lots of vitamin B foods, magnesium-rich foods, foods high in calcium, omega-3, foods like olive oil, nuts and seeds and salmon, or fruits and vegetable, whole grains, probiotic foods. Try to get enough sleep, at least 7 to 9 hours a night. Maintain a consistent rhythm, right? Get up at the same time, go to bed at the same time, all helps. Others love journaling, right? Write down your worries and your thoughts. Practice down writing things you're grateful for. Avoid the excessive alcohol, the drugs, the medication, the sugar intake. Sure, you need some supplements here, especially the vitamin B complex here often is really great. Adaptogenic herbs, magnesium, amino acids, all of that. Also volunteer or join a group, socialize more. It really helps here to divert your sort of thought patterns and the obsessiveness about thinking about certain things. Walk the dog in the dog shelter, whatever works for you. I decided to join a year-long self-mastery course in Qigong, right? I'm in the same position like you, and I need to take measures to heal myself as well. So, when somebody says to you, when you're really anxious, as I said before, maybe you just have a massage or, do some journaling, that works very well if we talk about mild anxiety, but not when you're in it. Then you need medications, and that's why I make this video, so you have some natural medications at hand right away to bring down the intensity of the anxiety so you can make educated decisions again. But before we go into that, I want to explain to you a little bit the metaphysical meaning about anxiety, some food for thought. Right? Maybe is there a story behind this whole situation? I always refer to Jacques Martel references here, and he said anxiety is a fear of the unknown. Right? We mentioned that. It's something like where you don't have control over. That can be compared to a state of anguish. It manifests itself in certain symptoms like the headaches, the flushing, the cramps, the nervous palpitation, intense sweating, tension overall, maybe increased rate of speech even, or crying, insomnia. It can be everything, under the sky here. But he says, if I'm anxious, I may experience a shiver of anxious, right? Literally, people start trembling. And this shiver comes from the cold and reminds me that I'm afraid. It is a sickness that grips my throat and makes me lose my self-control, and my control also over the events in my life, preventing me from using my good sense and my discernment. In this situation, you don't have the capacity to make educated decisions. It's not possible, and you shouldn't. You never should make a decision when you feel fear or anxiety. It's not the right moment. You rather say, hey, I don't feel so well. Can I sleep over it? I come back the next day. It will be much more a mature sort of like response to it. I may also feel either unbalanced, or disconnected from the physical world over which I may have some control, and from my perceptions of the immaterial world for which I don't always have any rational explanation or understanding. People say, why are you worrying? You got just your salary, you have some money in the bank, but you're worrying about poverty, right? So it's always in relation to it. I no longer have control. The sky may fall on my head. That's the experience at any moment in time, and I constantly have a feeling of imminent danger, but which sometimes is undefined. So I may be anxious in any situation, so I become whatever I focus my attention on, right? It says energy flows where attention, is directed to. So if you constantly worry about your worries and your thought patterns, you become it. And that's when it becomes uncontrollable. If my attention is constantly focused on my fear or this or that, I will surely experience anxiety, which can be more or less directly related to whatever resembles the fear of death or could remind me of, right? It can be. People, in a minute I will tell you some remedies, they really feel like, oh my God, I'm gonna die in an hour, or this is really too much. I'm gonna flip. Does the things I don't know or cannot see, but which can exist, make this fear rise up in me? I have no trust in life anymore. And then even if I fear the unknown and unconsciously deny life and therefore its process, right? You don't trust the process anymore in that moment because you're taken over by anxiety. So what's the solution here? Well, we're going to start first that you accept and acknowledge your anxiety. This should be without judgment. We all experience anxiety, and in this case, just say, yes, I recognize that this is really affecting the quality of my life. And it's more, ruminating around many hours in my life than it should be. So first you accept to focus my attention. And then you really go into this place where you say, I'm confident and certain that what is happening to me is all for the best, right? You're not a victim of this situation. In fact, even if it's challenging, it's an opportunity to rise to the challenge. Now and in the future, the symptoms will disappear. Nothing stays the same. Change is part of life. And do a prayer. This shall pass, and it will, along with the fear of dying. So let's go into remedies. And here I would like to bring in, as usual, homeopathic remedies. You can order them and purchase them online, even on Amazon, or purchase them at your local health food store. Make sure you get a good supplier with good quality remedies. So does homeopathy actually work for anxiety? And I say absolutely yes, 100%, 3 times underlined. The homeopathic remedies for treating anxiety are made from natural substances, so we don't have side effects. The homeopathic remedies work in a mild and gentle and effective manner to gradually reduce the physical and the mental stress associated with anxiety. So we're not just talking about treating your, feeling that you've got an elephant sitting on your chest, but also the mental and emotional causes at the same time. This is a holistic, this is a whole person treatment. We try to understand your psychology by talking, to the patient, to him or her, to ensure complete recovery here. As I said, any of these remedies which I'm going to share with you, they can be taken for months. I would choose because you don't have maybe a healthcare practitioner, but you should, always do that. The potency 30, that's the number behind the name of the remedy, which is also sort of liable to get over the counter. To continue them further or for the use of higher potencies or strengths, of course, consult with a professional homeopath and your healthcare practitioner. Also, do not use these remedies if you have already existing medical conditions. Of course, that goes without saying, like a heart complaint or a thyroid issue. You will have to, get a professional opinion here. And for guidelines or schedule your appointment, contact, my practice, Medica Nova, at health@medicanova.net. I'm happy to help you here. So what's the first remedy? The first remedy is called Aconitum napellus. And it's the first remedy for anxiety. It's a plant, and it's most frequently used remedy for managing anxiety, particularly acute anxiety. Now, the key indications to use, for anxiety is this marked fear, absolute panic. You maybe shake. There's this restlessness, and needless to say, the person says, oh my God, I'm gonna die, right? I'm hitting that threshold here. I even can predict when I die, right? That's the intensity of fear. In fact, yesterday, a patient who I haven't seen for the last 15 years contacted me and says, great to speak to you again. Sorry to bother you, but I'm experiencing really intense anxiety attacks right now, which doesn't let me sleep. Whatever I do is not right. What can I do? I did suggest Aconite napellus till I see here, because it was so intense, and the next appointment was 3 weeks down the road. So we say try Aconite napellus in the meantime, 3 times a day, 1 tablet, the 30 potency, and stay in contact me in a few days. Let me see how you're doing. So as I said, this is a remedy for intense anxiety states. With that comes the chain of bad thoughts which set in the mind. Maybe the cold sweat is present at that point. The face can appear hot or pale. One gets relief a little bit by drinking cold water, but definitely sleeplessness from anxiety, panic attacks, intense anxiety, heart palpitations, extreme fear of death, even to the point that the fingers or the toes become numb, or you have a tingling sensation. Sometimes people even can faint, right, to that degree. Aconite napellus is great. So when and how to use aconite, definitely if you have increased anxiety with panic attacks. It covers almost every aspect of anxiety, from fear, restlessness, shaking, sweating, palpitation, as I said, anything which is heightened. As I said, so it can be used in low potencies, but I personally say at this point 30C would be great, but contact your healthcare practitioner and you pretty much get prompt relief. Yes, it's difficult to say in a YouTube, and you shouldn't, that there are no guarantees, but it's a remedy which acts very fast, and you feel like, oh God, at least I can think again, or I can make the right decision. And that can be used for any situation. I remember a case, a woman who had to go to court, going through her divorce, and she had to face her ex-husband, and before the court appointment she literally went stiff and paralyzed and said, I can't go, it's like I can't face this situation. She took aconite and was perfectly well to go through this ordeal, and so you can see it acts quite fast. Another remedy I would like to share with you called is Arsenicum album. Remember I mentioned some experience sort of chest respiratory problems. Even if they have asthma, they feel like they can't breathe. They're equally restless, there's equally anxiety, but here we have a lot of difficulty breathing. That's the keynote here. There is a restlessness, as I said, trembling, cold sweat come with it as well. Often the anxiety gets worse at night here. Well indicated for people who worry and get anxious about little things. We call it trifles. It can be anything can it sets up. And they focus a lot, their worrying thoughts and concerns about their health. You know, if they have a symptom, they're the ones who go online and Google every symptomatology and say, okay, what is it? Am I dying here? You know, and a little bit out of proportion sometimes, they worry about the future, especially about money, finances. You know, it comes really strong here. Also, I would say they're very anxious about catching an infection. That's why this remedy was also indicated as a general epidemic remedy during the past pandemic, because people are worried or were worried that they catch the virus. So that helped very, very much so. Financial loss, right? As I said, facing poverty is big on their mind right now, and that can be the triggering factors. So aconite really works on the general theme, particular panic attacks, whereas arsenicum has specific worries more. As I said, health, finances, right? It can be anything, but mainly these are the sort of the topics. So when and how to use arsenicum, again, if you feel a chest constriction, if any asthma sufferer would notice or recognize this feeling, you can breathe in, but you can't breathe out. You know, there's some blockage in your chest, your breathing is affected, and with it comes this restlessness or pacing about. Also, these people can be really exhausted after their anxiety attacks. I would say arsenicum album 30, maybe twice a day. That would be nice for a week. Try it out until the intensity of the symptom calms down. We talked about that there is anxiety of public speaking, societal anxiety, right? And also anxiety of society in this sense. There is a specific remedy called argentum nitricum, which is a silver compound, and that is very much linked to situations for anticipation. We call it anxiety of anticipation. So this means that there are constant thoughts about events that maybe take place in the future. For example, a person may get anxious about public meeting or family function to be attended in the future even. He or she maybe keeps planning the event over and over until the event comes to the final day, and there are various thoughts, and it's the whole thing is wedding planners, right? It's like such a sort of compacted event. It needs a lot of thinking, lots of control, lots of planning, and there may be can be an exaggerated anxiety to the point that it goes into a panic attack, right? So all of that can be part of that. So they're preoccupied with various thoughts and then suddenly get symptoms. Like, for example, they go to church and suddenly they have to go to the bathroom all the time. Or they have a presentation to conduct, or they're on stage and they will say, oh God, will I reach there on time? Will I get my plane on time? What if I'm late? What if my car stops on the way? What will I do then? And so on. It's a rumination of these anxiety thoughts. It's not uncommon that these natives experience diarrhea of anxiety, this hurriedness, impatientness, weakness in the legs maybe, or other associated symptom. Again, performance anxiety, being on stage. What if I lose my speech? What if I lose my lines? What people think about me? Lecturers, what if I lose my lectures in between? And, all these sort of just worrying thoughts. And they preoccupy the mind over and over and over. And yet, when they go on stage and, they do their speech, it actually goes quite smoothly. That's why we say it's an anxiety of anticipation. It hasn't happened yet, and yet you go into this frenzy. Apart from, what I just shared with you, these people also have fear of heights, closed environments. So they have really almost panic attacks in a plane. They don't like to sit on the window, they like to sit on the aisle, maybe closed spaces in elevators, or even crossing a bridge, definitely out of their norm. They don't want to go there. Or, if they cross certain buildings fall on them. It's like this imaginary anxiety thoughts, but they are very real, right, for them. So when and how to use that? When it focuses on anticipatory anxiety. That's a great remedy, and it will work, and it will work very, very fast and well. It's a magic remedy, and I have helped hundreds of people with this remedy about anticipatory anxiety. I also want to mention a remedy called Kali phosphoricum. You can get it also, all these remedies you can get in your health food store. It's mainly for general anxiety, nervousness, and fear. Sort of there's a negative thinking, excessive sensitivity. Those needing it suffer from certain fears. Maybe, general, sometimes people say, I fear in crowds, or open spaces even, or being alone, or fear of death, sort of like, it's more sort of generalized fear, and you become very exhausted. This is also a remedy, it's called pick-me-up remedy, because it brings you back to create more energy within yourself. So you, when you feel just exhausted, even after a chronic disease, Kali phos is fantastic. But this kind of thing where you feel like, I really feel unsure when I go in a crowd, or, as I said, open spaces, it really freaks me out. Slight noises can even trigger their anxiety. And as I said, as an expression, then they feel really tired or fatigued after that. So that's really when you use Kali phosphoricum. I would say here the biochemic homeopathic cell or tissue salt form. Here in the US we have Highlands, the manufacturer. In the UK it's maybe New Era, or any homeopathic pharmacy can provide it. It's the potency 6x, and I would just do with adults maybe 2 tablets 3 times a day. With children you go down with the dosage, maybe 1 tablet 3 times a day. It just helps them to get over this situation. And this you can take longer, maybe for 2 or 3 weeks, and see how it goes. I also want to mention another remedy called Gelsemium sempervirens. It's a plant, it's the jasmine. That is specific for social anxiety. And here we have a public appearance. I know we talked about Argentum nitricum as a good remedy here, good too, but the expression of both remedies is different. Argentum nitricum is more about going to the bathroom, getting very nervous, sweating. Here with Gelsemium, we see excessive anxiety, nervousness. This is a great remedy for fear of going to the dentist, for example, right? There's this almost sadness or melancholy. There's confusion of the mind. People lose their thoughts. There can be diarrhea, but it's really, sure, it works with stage fright as well. But I would say they feel really exhausted. It sort of really sucks out their energy, this situation, which you don't see with argentum nitricum. They get really hyper, shaking, this kind of thing. How to use and when to use gelsemium? I would say anxiety in social gatherings, public spaces. It's a great remedy. I would choose 30C as a potency 3 times a day. You only will use that maybe for 2 or 3 days and you feel much better. I would also take that the night before the public event, and then maybe in the morning, an hour before you go in. That, often takes away that tense feeling. So I hope that this video has given you inspiration, also education, to find out more natural solutions how to manage and heal your anxiety. Don't forget to check out our website, medicanova.net, at the Medica Nova Online Education Department, where you find absolutely fantastic, inspiring home study online courses, as I mentioned before, in homeopathy, when you really want to learn about how to use these remedies among your friends and family members. Also, we have a course for pregnancy, birthing, and postnatal care. We have a course for integrated mental health, as I said, positive psychology and mental health, health and wellness coaching, and so many other great courses about quantum healing. So have a look there. They're available now. And if you have any questions, contact me at health@medicanova.net. So till next time, much love. Take care.